The Maharashtra government has begun revising its stringent guidelines for travellers to Mumbai after conversations with the centre, with the Union Health Ministry, which has advised it to conform to what the centre has recommended. But the Maharashtra government was also looking very closely at some of their recommendations on travellers and had started that process already. Now, for starters, fully vaccinated local domestic passengers can travel to Mumbai without an RT-PCR test, which had earlier been mandated by the Maharashtra government. This decision is perhaps the first of many more decisions from the Maharashtra government. To tell us more about this, we're joined by the senior minister, Aditya Thackeray. Aditya, thank you very much for being with us. Why have you decided to revise many of the guidelines which the Maharashtra government had introduced?
We've just had a meeting in the afternoon to review some certain guidelines that we have issued yesterday. But for us, what comes first and really matters the most is safety of the citizens, be it staying here or traveling to and from our state. If you see what's happening with Omicron in terms of, even the line that I've been reading on NDTV and all the news articles that we've been seeing, it is exponentially growing in certain countries. Certain countries have really banned flights to and from the countries. So I think it's about time for us to really wait and watch for the strength of the strain as yet. But the first focus really is to safeguard our citizens. We've just come out of a deadly second wave. We're sort of, the virus is still around and we're just taking precautions. We're being cautious, but for the safety of our citizens.
Okay, so let's just go through a couple of these tests. Mandatory RT-PCR testing on all international travellers at Mumbai airport. Will this be required?
No, so you would see the new guidelines, the revised guidelines that we have just done in consultation with the airport, the police, the doctors and the chief minister in about 1 hour's time. That will be the revised guidelines that will come out, which looks at the convenience of the passengers. But yes, we are being slightly firm and strict on certain, safety measurements and requirements in terms of the high-risk countries. So that is what we are really looking at.
And by high risk,
I wouldn't be able to divulge much of the revised guidelines before it is published, really.
And what about the high risk countries? By high risk, I asked the word high risk as opposed to at risk, because at risk was what the centre actually said. They referred to that. But by high risk, are you referring to countries in South Africa which have had the maximum impact thus far of Omicron?
Absolutely. There are sources of origin for the strains where it has been found. And in fact, too much of the credit of the doctors that they actually took the efforts to find it. But now it's up to all of us as the world to stand together, take whatever steps are important to control this strain. And, like science mandates, let's wait for the science. Let's wait for WHO to confirm the strength of the strain. As of now, we know that it's growing exponentially in many countries around the world and it's growing multiple times. So that is really matter of fear for us, because we've just come out, like I said, from a deadly second wave. The Delta, if it is being replaced or not, if the Delta remains, how strong is it in terms of comparison with the Delta? Finally, we do not want people on hospital beds. We do not want people on oxygen. And that's why we're taking necessary precautions to prolong as much as possible in terms of the entry of the Omicron into Maharashtra.
Aditya, a very interesting point over here is that the state government had actually issued guidelines to be implemented from 12 a.m. this morning. In other words, passengers would actually come in, would go into institutional quarantine. But you felt that this was actually unfair on many of these passengers, perhaps 1,000 plus, because there were at least 3 flights coming in from the United Kingdom. And these passengers wouldn't have known about the rules which have just changed. Is that one of the reasons why you did not implement early this morning?
No, even with our last time's guidelines for the second wave and post-second wave also, every time we've issued a guideline, when it is something like a vessel or flight which is airborne, you obviously cannot implement them because they have flown without prior information. So when they landed, what we ensured is everyone went through an RT-PCR test and basically the BMC and other local bodies, be it Pune and Navi Mumbai, have been informed by the airport authorities, and we'll be tracking them over the next 14 days for any symptoms, and we'll be, of course, checking them with RT-PCR tests and lat flow. So that is the whole protocol that we have sort of issued.
So broadly speaking, the guidelines which will now be in place will be essentially one India, one set of guidelines. Would that be fair to say?
There are certain things that we'll have to probably have in a stricter fashion, because if you see last time also we were hit first, we were hit the hardest. And in the sense of, even being accountable and transparent, we were always accountable and transparent and have been. So we need to be a little more cautious about our state, because we have a lot of floating population that comes in and goes out, not just in terms of tourism, but in terms of business, commerce. So we need to protect the interest of the state in terms of everyone who comes here for tourism, or trade, commerce, or for whatever reason, to safeguard their safety and the citizens living here. So we're balancing both and the convenience of the people.
But just one important clarification, because this was one of the key points, institutional quarantine for those from at-risk countries. I know that there will be RT-PCR tests at the airport for these at-risk countries. That's already there.
Yes.
And if you clear it, you can leave. But will there be institutional quarantine for these individuals?
That you shall see soon. We have reviewed the guidelines. But like I said, I cannot divulge much out here since it is already in the process. It wouldn't be fair to the officials to divulge much here before they get the okay of the Chief Minister.
I totally understand that. But let's just talk a little bit about then the Omicron situation in Maharashtra. Now, earlier today, there were a number of individuals who were tested. I believe there were travelers who had come into your state. I think there were 6 odd of them who were tested for and genetically sequenced, I believe, for the variant of COVID which they may have had. Is there any progress on that? Are there any indicators of Omicron already?
As of now, no. Hopefully it remains like that. Like I said, there are a couple of factors we're looking into. One is, of course, waiting for the WHO and the relevant authorities, be the ICMR, to come out with more information on it after some studies on it. So that is one. The other is we were really hopeful of opening up our schools from first standard and to the 8th standard, also the primaries, pre-primaries, all of it. But we have sort of delayed it by 15 days because we want to sort of safeguard the situation. Now, there was one report where I saw that this strain has actually infected little kids. Now, the demography that will, infect, or whether it's the vaccinated, unvaccinated, to what extent does the vaccination really safeguard from Omicron? I think that is something, of course, we're all waiting for very keenly and very eagerly for the scientists and the doctors to speak out on. And as soon as we have a certain mandate from them, that is how we will, review our guidelines again.
Booster doses. What are your views on this? Because on the one hand, we've got many countries around the world starting out with booster doses. We haven't done that in India. Our priority is to get everybody 2 doses. But you know what Adar Poonawala was telling us on NDTV yesterday is that there is no dearth of vaccine availability. So everybody who needs 2 doses will be given 2 doses, and everybody who wants to, even if they want to buy a vaccine for a 3rd dose, can go ahead and do that if orders are placed. Is your state government in favor of that, of a booster dose right away?
In terms of vaccination, now it is going at a good rate. It had dropped a little bit, but right after the news of a new strain, it has increased and people have got back to especially the 2nd dose. So that is very, very important. In terms of the booster, as an administrator, as a politician, even though I have a personal opinion, I wouldn't want to comment on it because, again, we have a task force of doctors and pediatric task force, the senior task force, both discussing about it, and soon would be speaking on it. However, we just had a review meeting for the city of Mumbai, of which, we're looking into also very closely, and 100% of the 1st dose and about 72% of the 2nd dose has been covered. We would be writing to the government of India to not change our delivery schedule of the vaccines, but allow us at a shorter gap so that we can at least cover 100% of our population with the 2nd dose. So at least Mumbai and a couple of more cities and many more districts are fully vaccinated by at least mid-January. And that is the real intention, so that we have a certain amount of protection of fully vaccinated people in our state.
Now, this is important. 100% have got their 1st dose in Mumbai, 72% have got their 2nd dose.
Yes, slightly more than 100% in terms of the floating population that comes in from nearby districts into Mumbai as well, or other states that come into Mumbai. So
they've been vaccinated as well.
Yes.
So that's would Mumbai therefore be number 1 among the big cities in the country, the metros, in terms of vaccination? 72% 2nd dose.
2nd dose, yes, probably yes, and we're hoping all other cities, are shoulder to shoulder, because we all have to be protected today.
Now, this is great news, Aditya. When do you expect 100% full vaccination for the city of Mumbai, which is one of the largest cities on earth?
If possible, if the gap reduces to about 4 to 5 weeks, and we're going to, also speak to the government of India, we have had informal communications, we could finish it off by 15th of Jan.
So, in other words, you are in a position to finish it off. It's just because there is a specified gap
Yeah.
between the first and the second doses, that you can't do that.
Exactly,
Right.
but otherwise...
But that's just a matter of a few weeks, right? Either way, it's just a matter of a few weeks.
It's a difference between January or April beginning. So that is the gap really that we are really facing. And if we can reduce it to 4 to 5 weeks, 15 to 20th January is the date we can finish off 100% for the second dose. And Mumbai will be largely protected. Again, it's very crucial because from here, you've got a lot of interaction with Pune, Navi Mumbai, Thane, the entire MMR region, PMR region. A lot of businesses, a lot of corporate sector will be protected in that sense to be fully vaccinated.
Yeah. What are your views on pediatric vaccination?
Like I said, for me, it's very easy to give my views, but I wouldn't want it to be headlines or, running as a scroll saying Aditya Thackeray says that, because finally we are not men of science. We need to depend on men of science. And I believe the ICMR has started certain trials of the pediatric vaccination, but I hope that there is certain vaccination that comes out very soon for the children, because I've seen children who want to send their, wards to school. They want to send their girls and boys to school. And there's a dichotomy between, or rather little fear of sending and not sending, because not sending is really affecting the social growth of the kids. But if you send, there's also the risk of COVID. So that really nuance we have to gap with vaccination or any other protection that we can accord to the children.
All right, Aditya Thackeray, always wonderful speaking to you. And I think the big takeaway for me is that in a finite period of time by January, if that gap is reduced between vaccine doses, you'll have 100 and 100. 100 first doses, 100% second doses. The first metro, I believe, in Delhi, in India, which would actually have 100% coverage for vaccines. That's incredible, but once it does happen, it'll protect us to a great extent. Thank you very much indeed.
Thank you. Thank you so much.